Hello, and welcome back to BIAV's Advocacy webinar series. This is part 5, or the annual calendar, also known as sort of the method to our madness. I think we all grew up with Dr. Seuss, and this is one of those quotes. I think it's from Horton Hears a Who, but I'm not entirely sure. But it goes like this: unless someone like you cares a whole lot, nothing is going to change. It's not. And I think that sort of summarizes a lot of where we find ourselves today in brain injury advocacy. You know, I'm often doing presentations and I'm looking out at the audience and I'm talking about people needing to get involved, and I see what's going through everybody's head. Somebody's going to do it. Well, you're that somebody. So let's start caring, and we'll talk about the annual calendar. So the state constitution specifies the length of the General Assembly, and it sort of varies from year to year. In short session years, it's 30 to 45 days, and in long session years, it's 60 days. And the governor can convene a special session when it's in the interests of the Commonwealth. So we just had a special session over the summer because of all of the needs around COVID and some of the social justice issues that were being brought up. But right now we're looking forward to the 2021 session of the General Assembly. And the way this is going to work is that in December of this year, the governor is going to present his budget. In past years, every January, there have been budget hearings across the state on the second Wednesday, and usually before the second Wednesday in January. I don't know what that's going to look like in 2021 because they're usually very crowded affairs. We'll keep you guys updated on what the news on those budget hearings are, but we do know that the second Wednesday in January will mean the start of the general session. The crossover mark is the halfway point of the session, and that's important for when bills are approved or vetoed and when budgets are sent to the other house for review and that sort of thing. The Sunday after crossover is specifically for the budget bills. Usually the session will end sometime in February or March, and then in April there's almost always a reconvened session to take action on whatever the governor did to the budget or the bills after the session adjourned. And then July 1 of 2021 will be the effective date of any enacted legislation. So what BIAV does prior to the session is, you know, we do a lot of research, we talk to peer organizations, we look to see what laws are being passed in other states, and then we arrange an annual legislative retreat. For this retreat, we have advocacy partners come and meet over a series of days or calls, and we determine, you know, sort of what our priorities for legislation are. Through focus groups and surveys and talking to our board and working with the Virginia Alliance of Brain Injury Service Providers, we drill down on what it is that we're going to be asking for in the upcoming General Assembly. We have a legislative consultant that works with us, and during the fall, we are developing what's known as talking points, or the arguments that we are going to make in support of a particular bill or budget amendment. During the session, in normal years, BIAV is planning Awareness Day, but we're not going to have an Awareness Day like we have had in previous years in the 2021 session, because the House is going to meet virtually, the Senate is going to meet in person, but I'm not sure they're having committee meetings or taking legislative meetings with constituents. Everything's just sort of really up in the air right now. So we're not necessarily planning on holding a traditional sort of Awareness Day. What we've been doing is working with patrons and legislators and programs to do some pre-session education and making sure that we are educating the folks that are going to be advocating through this series of webinars, through a call to action video that's going to go up on our website, from letter writing templates to information on how you contact your legislators. All of those things are going to be part of the work that BIAV is doing prior to and during the session to make sure that we make it as easy as possible for you to help us with our advocacy efforts. And after the session, the rest of the year, BIAV Works is sort of an agency watchdog, and we attend policy meetings and we provide public comment and we go to stakeholder group meetings, and we just try to make sure that we're staying informed about everything that could benefit or perhaps even harm individuals with brain injuries and their family. You know, I've mentioned the Virginia Alliance of Brain Injury Service Providers several times, and we have a great partnership with them. This is a group of programs that are funded primarily by the state through a line item appropriation that we've gotten through our advocacy efforts that goes to the Virginia Department for Aging and Rehabilitative Services. They're the lead agency for brain injury in Virginia, and when the General Assembly decides we should get more money, it goes into the DARS budget pot, and then DARS, through a variety of processes, makes sure that it gets out to the programs. But we really rely on the Alliance members to help inform our policy agenda. They're talking about the things that they know the people they're serving need, and how to perhaps form our arguments and what's our priority. We also rely on them to educate and mobilize their clients and their clients' families and the members of their boards as well. BIAV certainly does a lot of outreach, but the Alliance members are really great about getting their folks juiced up to participate in advocacy initiatives. And the Alliance members also write a lot of letters to legislators and make sure that we have speakers at places like the budget hearings or other testimony opportunities that we have. In working with the Alliance as part of our legislative retreat, we made a 3-year goal that consists of this. Everyone in Virginia with a brain injury has access to local, ongoing, and community-based supports and services from an experienced brain injury service provider. So everything that we do is focused on that goal. So, you know, what BIAV does to prepare, like I said, you know, we do a lot of researching bills in other states, and we write up a summary and give it to some of our collaborators to see what they think about some of the bills that are happening in other states and if that's something that we should do. A really good example of this is when we got the sports concussion bill law passed in Virginia. We saw other states doing it. We looked at the language they were using. We found us a patron. We relied on the success of other states and were able to get that bill passed in Virginia. I said earlier, we conduct surveys and focus groups, and we ask people what's on their mind and what are they thinking and what's the biggest challenge that they're dealing with. And we do a very thorough needs assessment. So when we undertake a needs assessment, we look at all of the information that we're getting from people who are calling our information and referral hotline. When people call us, they tell us, you know, we're having financial hardships, or I'm looking for a place for my loved one to live, or I need information about how to manage memory problems after brain injury. We take a lot of information from the calls that we receive, and we look to see what people are calling us for. And then we use that to, in part, determine some of our legislative activities. We look at prevalence estimates of brain injury across the state of Virginia. We look to see where current brain injury programs that are funded by the state are and the areas of the state that they're serving and the areas of the state that nobody is serving. We look at the number of people that are being served at the community level by state-funded programs, and we look at the numbers on waiting lists for those services. And all of that information helps us develop some ideas for a policy agenda that we then get our stakeholders to weigh in on. This is a sheet of information that we provide to legislators and develop every year, and you can see that some of the information I just talked about is included on this fact sheet. We call it a public policy guide. At the very beginning, there's a few specific numbers about the number of people who are hospitalized as a result of brain injury and how many people are disabled because of brain injury or maybe stroke. We also document the number of people who are served by those state-funded community-based programs and the number of people who are impacted. And you can see in those graphs the types of services that we're talking about and the different ways that we are impacting people across the Commonwealth who need to know a little bit more about brain injury. And on the second page, you see a list of the programs that are providing some of these state-funded core safety net services of resource coordination, case management, and community-based clubhouse and day programs. When you look at that map, you see some color-coded areas, and those outline different service areas of providers that are funded through DARS. And the areas in white are the areas where there is no state-funded provider currently serving folks with brain injuries other than BIAV, because we support the entire state. When we had our 2020 legislative retreat preparing for the 2021 session, you know, there's a way that we go about this every year. We come in with a few assumptions. So we knew that this was going to be the second year of a biennial budget. Remember, Virginia does a 2-year budget. And in the second year, they generally don't fund a lot of new initiatives. It's sort of a budget adjustment year. We also knew that the budget would likely be significantly impacted by the pandemic, and we asked for $6 million last year. Maybe we should ask for a little less and really focus on the things that we need in the 2021 session. So by doing that and having those conversations, we identified 3 budget requests and 1 bill request, and you see those listed here. These should look pretty familiar. We've been over them in previous webinars. But in 2021, we're going to be asking for $1.4 million for workforce retention. We know that we need to raise salaries and improve benefits to keep competent, qualified staff working for our state-funded, community-based brain injury programs. And we need money to do that, money that's not tied to new services or new service areas, which is the case, has been the case for the last several years every time we've gotten new money. We just need some money to increase salaries and benefits. We're also asking for $1 million in expansion of community support services, things like virtual programming and case management, and life skills training, and positive behavior supports. And we're going to be asking for $1 million for housing supports. We don't know exactly what that's going to look like right now. We're still working on that. And if you're watching or listening to this webinar and 2021 is already passed, you can go to the BIAV website and see what our current legislative agenda is asking for. And I'd encourage you to do that. We're always going to have current information about our requests. We're going to have letter writing templates for you, and we're going to have information on how you can contact your legislators. For the 2021 session, we're only pursuing 1 bill, and that bill is to update the definition of brain injury that appears in the Code of Virginia. The Code of Virginia is actually the law book for the state, and we need to have the definition of brain injury updated. So each year, you know, we have to create a calendar that works with the General Assembly calendar. And what we've been noticing over the last couple of years is that the agencies have been requested earlier and earlier to get their budget requests into the secretariat under which they're located. Last year, they had to have their budget requests in August. So traditionally, we've held our retreat in September, and that ain't going to work anymore. So we're going to adjust it for 2021. Instead of waiting until September, we're going to start doing the retreat and the session prep in May and in June. And we'll be providing information to the folks that participate in our legislative retreat and for folks that participate in surveys and focus groups, and we'll start getting that stuff out in June and July. We plan to have a budget request, or at least the outlines of some budget requests, to the Department for Aging and Rehabilitative Services in August, so that the commissioner can send it up to the Secretary of Health and Human Services. Throughout September and October, we'll be looking to see if we can find patrons for the bills and the budget requests that we're seeking. Usually we like to have that locked up as early as possible, but if we need to go into November and December, we certainly will. We're anticipating that we'll have some sort of way to provide input on the budget through some sort of public testimony, whether that's provided in a written format or some other way, but we're assuming that we'll have that opportunity, and we'll be getting ready for that. We'll be putting information on our website. We'll be doing a webinar on what kinds of things we're asking for. And so all of that will be happening in January, and we'll be working on getting the bills and budget amendments passed throughout the month of January and for as long as the session goes. Sometimes it's February, sometimes it's March, but we're in for the long haul. And then come April, we're just going to get ready to do it all over again. That concludes section 5, and the next one is section 6, and that's going to be the last one, and it will include information on how to contact your legislators. So thanks for your attention so far.